Okay, we'll take our next question. This is from a chatter in the chat room, so go ahead, please. Well, ODD is oppositional defiant disorder, which is a psychiatric disorder that's characterized by two different sets of problems: aggressiveness and a tendency to purposefully bother and irritate others. And the aggressiveness is usually the reason that people seek treatment or are forced to do treatment. ODD rarely travels alone. It's usually in conjunction with some other disorder, usually ADHD, but also depression, anxiety. So whenever there are two disorders present, it does make life for that child much more difficult than just having one disorder. For example, ADHD plus ODD is much worse than just ADHD. There's a certain set of criteria that the individual has to meet in order to have the diagnosis of ODD. To just give you the definition of ODD, it's a pattern of negativistic, hostile, and defiant behavior, but it has to, those criteria have to last at least 6 months. And during that 6 months, at least four of the following have to be present. Often loses temper, argues with adults, defies or refuses to comply with adults' rules, deliberately annoys people, blames others for his mistakes or misbehavior, is often touchy or easily annoyed by others, angry and resentful, spiteful and vindictive. So if 4 of those criteria have been in place for the last 6 months, then it's a safe bet that this individual would be diagnosed with ODD by a psychiatrist. Your other question was what causes it. Like most psychiatric illnesses, there are 3 main causes: environment, genetics, and medical problems. The usual pattern is for problems to begin between ages 1 and 3. If you think about it, a lot of these behaviors are normal at age 2, the terrible twos. But in ODD, the terrible twos never go away. ODD does run in families. If a parent is alcoholic or has been in trouble with the law, their child is almost 3 times as likely to have ODD. Your other question was, how can you tell if a child has it? Well, ODD is diagnosed in the same way as many other psychiatric disorders. You need to examine the child, talk with the child, talk to the parents, review the medical history. Sometimes other medical tests are necessary to make sure it's not something else. You always need to check children out for other psychiatric disorders. It is common that children with ODD will have other problems also. A complicating factor is that some sleep disorders look like ODD or make ODD even worse. And your last question was who gets it? Well, a lot of children get it. In fact, it's the most common psychiatric problem in children. Over 5% of children have this. In younger children, it's more common in boys than girls, but as they grow older, the rate is about the same in both males and females. Thank you for your question.